Welcome everybody to the FirstLink Learning Series, First Steps, an overview of the dementia journey for care partners. My name is Leslie Latchford and I am a FirstLink Care Navigator and Support Counselor with the Alzheimer's Society. This session is one of 4 modules, so please look for the other 3 weeks in the series. This module will present an overview of dementia, looking at symptoms, diagnosis, and treatment. Please have a pen and paper handy for both the self-reflection sections of this presentation, as well as to write down any questions that may arise for you throughout. Questions can be addressed by contacting your social worker at the Alzheimer's Society or by joining us at one of our monthly caregiver support groups. Keep in mind that this webinar isn't intended to replace the FirstLink Learning Series sessions that are offered in person at the Alzheimer's Society. Please consider registering for our in-person sessions when they again become available. Also note that this education presentation is for your knowledge building. As everyone's situation is unique, the information provided in this presentation is for educational purposes and not specific advice for your situation. Please visit our website at www.alzheimerlondon.ca for a staff list, as well as for information on upcoming support group meetings and other education webinars that may be of interest. Thank you. So today we're going to look at what is dementia. We're going to talk about the symptoms, diagnosis, and treatment. Module 2 will look at adapting to brain changes. In Module 3, we'll talk about planning ahead. And in Module 4, we'll talk about risks, caregiver support, caregiver stress, and building a circle of support. So I just want you to take a moment here to do a little bit of self-reflection and think about the question, how did I know? So take a few minutes to reflect on the symptoms that you noticed in your loved one, perhaps some changes that you recognized that made you perhaps call the Alzheimer's Society to ask some more questions, or supported your decision to call the doctor and sort of investigate further as to what was going on with your loved one based on the changes that you were noticing. So just take a few minutes to reflect back on that question, how did I know? Okay, we're going to move on and talking about the different types of dementia. So first of all, in terms of defining dementia, dementia is not a disease itself, but a set of symptoms that accompanies a disease. And these symptoms are severe enough to interfere with the person's ability to function on a daily basis. And symptoms include things like memory loss, decrease in judgment, disorientation, changes in personality and behavior, difficulty handling complex tasks, and there are others as well. We'll talk a little bit more about some of those early signs and symptoms later in the module. There are reversible types of dementia and irreversible types of dementia. So your reversible types of dementia are symptoms that are a result of conditions that once are treated, then those dementia symptoms will typically subside or go away. So we refer to things like medication interactions, tumors, depression, kidney failure, vitamin deficiencies, delirium, which is a medical emergency. It's an acute and fluctuating onset of confusion, disturbances in attention, disorganized thinking, or decline in level of consciousness. So when somebody is experiencing a delirium, they will exhibit signs of dementia. Diabetes is another reversible type of dementia. So again, where the underlying cause can be treated, then those dementia symptoms will typically subside or go away. Our irreversible types of dementia are those that are listed under the umbrella here. So we refer to Alzheimer's disease, frontotemporal dementia, Lewy body disease, vascular dementia, and mixed dementia. And those are the ones we're going to talk a little bit more in detail as we move through this presentation. So again, irreversible in the sense that we are not able to reverse the damage that's been caused by the disease. There's currently no cause or cure for the disease, and as a result, the person progresses and the symptoms are irreversible at this point. So Alzheimer's disease is the most common form of dementia. It is not a normal part of aging. So certainly as we age, we do experience some normal cognitive changes. Our memories are not as sharp as they are as we age as to when we are younger. But the characteristics associated with Alzheimer's disease and the changes that somebody living with Alzheimer's disease experiences are not typical for normal cognitive aging. Essentially, plaques build up outside the brain cells and tangles develop inside the brain cells. And in Module 2, we will investigate this a little bit further in terms of the pathology in the brain. But just to keep in mind that plaques are building up outside the brain cells and tangles develop inside the brain cells. Alzheimer's disease starts and progresses gradually or slowly. Memory loss, problems with language, changes in judgment, mood, and behavior are some of the symptoms associated with Alzheimer's disease, and certainly this slide just scratches the surface. So we've linked here a link to the Alzheimer's Society of Canada's webpage, and you can take a look at this link and get more detailed information about Alzheimer's disease. We're going to talk about the early symptoms in a few slides, but essentially if you're looking for more detailed information about Alzheimer's disease, I do invite you to visit this link and the Alzheimer's Society of Canada's website. Frontal temporal dementia accounts for approximately 10% of all dementia cases and 20% or more of dementia in individuals under the age of 65. So this is a type of dementia that tends to affect people at a younger age. Often they're still working. The frontal and temporal lobes of the brain are affected, and symptoms often affect personality, behavior, emotion, language, speech, abstract thinking, and movement. So those parts of the brain, the frontal and temporal lobes that control our actions, our personality, our insight, our social regulation, social judgment, and our language centers, those are the areas of the brain that are impacted initially in the frontal temporal dementias. Memory loss does occur, but tends to occur later in the course of the disease. Again, there's another link here to the Alzheimer's Society of Canada's webpage, specifically on the frontal temporal dementias. So I invite you to visit that if you're looking for more information on this type of dementia specifically. Okay, I just wanted to share with you this slide that shows you some the subtypes of frontal temporal dementia. So there's various subtypes. Pick's disease, the one at the bottom there, is one that you may be familiar with. The behavioral variant is certainly one that we see here at the Alzheimer's Society and support individuals and care partners who are living with the diagnosis of the behavioral variant form. So in terms of the behavioral variant form, we see changes in personality, emotion, and or behavior. So some possible symptoms may include eating only certain types of foods, typically sweets, disinhibited actions, so they may make inappropriate comments, apathy, the lack of motivation to do things, lack of insight, lack of social judgment and regulation, unaware of the impact of their symptoms on others, as well as impaired decision making. The other one that we see as well is the primary progressive aphasia. So where there is a deterioration in the ability to produce speech. And again, this slide does break it down in terms of symptoms for the various subtypes. So if you are interested in learning more or are supporting somebody with a variant frontal temporal dementia diagnosis, please reach out to your social worker if you are looking for information on that specific subtype. Lewy body dementia. So Lewy bodies or protein deposits form in brain cells. Symptoms are similar to Alzheimer's, but there is large fluctuation in thinking and the ability to focus. So that's sort of what differentiates the Lewy body dementia from the Alzheimer's. There is memory loss that does occur, but typically later in the course of the disease. The other distinguishing features of Lewy body dementia is the visual hallucinations. So people with Lewy body will experience these visual hallucinations, typically of people, children, and animals. They will also experience Parkinson-like symptoms. So the muscle stiffness, the tremors, the shaking, the slow shuffling gait, so symptoms that are commonly associated with the diagnosis of Parkinson's disease. Lewy body may have a rapid progression. I supported an individual who lived 3 years from pre-diagnosis to death, so progressed very rapidly. There is here a link to the Alzheimer's Society of Canada's website that takes you to the information on Lewy body dementia. So if you're interested in reading more about Lewy body dementia specifically, then I invite you to visit this, this link here and this information on the Alzheimer's Society of Canada's webpage. Vascular dementia is caused by damage to the brain, so lack of oxygen from one or more strokes. Often people will have had many small or mini strokes. Changes happen suddenly in a step-like way, so when the stroke occurs, we see the change in the individual. Symptoms then depend, of course, on what area of the brain is affected by the stroke. There is a link again here to the Alzheimer's Society of Canada's webpage that will provide you with more detailed information on vascular dementia. Mixed dementia is the second most common form of vascular and Alzheimer mixed dementia type. So it's characterized by symptoms and abnormalities of more than one type of dementia at once. Usually it's the combination of Alzheimer's disease and vascular dementia. It may follow a pattern similar to either Alzheimer's or vascular, or a combination of the two. We're going to move on and talk about the warning signs, so symptoms in the early stages. And much of what you see on this slide may be things that you thought about in terms of those early signs and symptoms that you noticed when I had you do some self-reflection at the beginning of this presentation. So things like the memory loss that affect the person's ability to function on a daily basis, or maybe some problems with language. Those may be things that you noticed in your loved one that prompted you to either seek out further assessment or call us for more information here at the Alzheimer's Society. So we're just going to move on and talk a little bit further about these warning signs. So there is this pictograph here, and these are available at the Alzheimer's Society. So if you are wanting a hard copy of this, please reach out to your social worker and they will send you one in the mail. So number one, memory loss that affects day-to-day function. So short-term memory loss is typically what's noted. Long-term memory seems to be well preserved late into the course of the disease. So forgetting dates and appointments, forgetting things and struggling to retain new information as well. Difficulty performing familiar tasks. So again, we said that dementia affects the person's ability to function on a daily basis. So performing tasks that they've been doing their whole life, like getting dressed or preparing a meal. Problems with language, so word finding difficulties, substituting words that don't fit the context, forgetting words. Disorientation in time and space, so not knowing what day of the week it is or getting lost in a familiar place. Impaired judgment, so not recognizing a medical problem that needs attention, perhaps wearing light clothing on a cold day, so not dressing appropriate for the weather. We see impaired judgment when it comes to things like safety, things that present with a safety risk like driving a car or cooking. Problems with abstract thinking, so having difficulty balancing a checkbook or not understanding what numbers are or how they're used. Misplacing things, so putting things in strange places like a dress in the fridge or a watch in the sugar bowl. I worked with a gentleman who, when his wife passed away and he was cleaning up some of his library, found large amounts of money hidden in these books. So a very strange place to put money, some may think. But again, you know, putting things just in odd places that really just don't make sense. Changes in mood and behavior, so perhaps exhibiting severe mood swings from being easygoing to quick-tempered. Changes in personality, so perhaps behaving very much out of character, you know, becoming confused or suspicious or fearful, and the loss of initiative, so losing interest in friends, family, and favorite activities. And we see this quite a bit where, you know, the care partner will tell us, you know, he's becoming more withdrawn or not attending those the activity or the regular card game that he used to go to every week and really enjoy. So perhaps the individual is recognizing some of the changes in themselves and just not comfortable in those social settings any longer, so they start to withdraw. We'll move on to talking about diagnosing dementia. So essentially what they want to do is rule out the reversible causes. So if there's any underlying condition or disease that is attributing or causing these dementia symptoms, they want to rule those out or treat those accordingly, so that if in fact that is the cause of the dementia symptoms, then those symptoms will subside with treatment. So they're going to do a physical exam. They're going to do some cognitive testing. They're going to do functional testing. How is this person functioning on a daily basis? They will likely administer a depression scale to rule out depression as the cause of the symptoms. They may more than likely do some neuroimaging, so whether that's a CAT scan or an MRI or a SPECT scan to rule out strokes, to rule out brain tumors or any other abnormal brain pathology. They will likely do blood tests to rule out vitamin deficiencies. They will also, most importantly, want to speak to you as the care partner to get your account of how things are going, how the person is functioning, the symptoms, the changes that you've noticed in your loved one, how long these changes have been happening for. Typically what they'll do is they'll meet with you and the person who's being assessed together and then separately, so that you can provide some very good insight into how that person's functioning and how they've changed. Sometimes the person living with the dementia may lack insight, so they may go into the appointment thinking, why am I here? There's nothing wrong with me. She's the one with the problem. So your account as a care partner, whether your spouse, adult child, friend, neighbor, is going to be very key in terms of helping with that assessment process. In sharing the diagnosis, so after being given a diagnosis, you and your loved one may or may not have shared this with people in your lives. You may have been very open about the diagnosis or selective in whom you've told and what you've shared. And certainly we see both sides of the coin when it comes to sharing the diagnosis. We work with individuals who have received their diagnosis, who are very comfortable talking about the impact that this has had on them, on their family, on their loved one, on their life, and sharing that with others. And we've worked with others who, have chosen not to share the diagnosis with family, friends, community, and that's a really personal decision. So we are here to support you in, whatever this looks like for you. So please reach out to your social worker if you're struggling with how to share this diagnosis with other people, or if you as a care partner feel like you're wanting to share, but the person who's been diagnosed doesn't want to share, reach out to your social worker so they can help navigate this with you. Just to do a little bit of self-reflection, though, coming back to sharing the diagnosis, take a few minutes just to think about your experience of sharing or not sharing the diagnosis. And if you or your loved one have not shared the diagnosis openly, why haven't you chosen to share? And what would need to happen for you to be able to do so? If you have been sharing the diagnosis openly, what approach worked best for you? What supports have helped? And what advice would you give someone who wants to begin sharing their dementia diagnosis with others? So just think about that for just a couple minutes here. So I've linked here a very short YouTube clip. It's Linda's story, talks about her experience of being diagnosed with Alzheimer's disease and subsequently her involvement with her local Alzheimer's Society and how much value that has added to her life following her diagnosis. She talks about feeling the relief that came along with being diagnosed, and we hear that often too, where once a diagnosis is made, there is that sense of relief. Okay, now we know what we're dealing with. Now we can access supports that will help us through this journey and help us to better understand what the future holds. She talks about sharing her diagnosis and what that looked like for her. She talks about experiencing a higher quality of life given her involvement with the Alzheimer's Society and how it's added value to her life post-diagnosis. So if you have a minute to watch this, it's about 3 minutes long. I invite you to do so. So we're going to talk about treatment options. And there's two ways to think about treatment. So the drug and the non-drug options. And we're going to talk about the drug options, but keep in mind that the drugs that are available to help treat the symptoms are just that. They are treatments for the symptoms. They improve some of the symptoms, or slow the rate of decline, but they are not a cure for the disease. Important to note that not all approaches work for everyone. So to be informed, have conversations with your doctor, with your pharmacist, really important when it comes to medication. So there's 4 medications approved by Health Canada. With Alzheimer's disease specifically, Alzheimer's disease lowers brain levels of acetylcholine, which is a brain chemical thought to be important in learning and memory. So the 3 medications that are approved, Aricept, Remenol, and Exelon, work by increasing the levels of acetylcholine in the brain, but they do not stop the underlying disease process. For people who have taken these medications and taken them successfully in terms of tolerating and not experiencing too many side effects, care partners have reported that they have noticed the person's ability to function better on a daily basis, some improvement in symptoms. So for those, again, who have been able to take it successfully, it can be quite effective. Of course, we all, medications will work differently in individuals depending on other conditions or other medications we're taking. So again, when it comes to medication, really important to have those conversations with your doctor to determine that they're right for you. Abixa is another medication. It's prescribed to individuals sort of in the mid-stage of Alzheimer's disease. It works by blocking the reabsorption of glutamate, which is another brain chemical. Sometimes they will prescribe Abixa in combination with one of the earlier medications, the Aricept, Remenol, or Exelon, and have had some success in terms of combining those 2 medications. So again, conversations to have with your physician in terms of what will be best for you given your diagnosis and other conditions you are living with or other medications that you are taking. So it's important to remember that not all medications are appropriate for everyone. The decision about which treatments will work best is between a doctor and a patient, and the type of dementia, other medications being taken, and other medical conditions are just some of the factors that need to be considered in making this decision. And certainly, some people choose not to pursue drug treatment. It's a very individualistic decision. There is a link here to the Alzheimer's Society of Canada's webpage. There's information on medications. Are they right for you? So please invite you to visit that information if you are looking for more details around the medication piece. So of course, there are other options in terms of alternative therapies. So things like ginkgo biloba, coconut oil, vitamin E, which you may be familiar with or have heard about. So really important not to assume that natural means safe. It's important to question claims that seem extreme or that don't have evidence to back them up. So the medications that I referred to on the previous slide are approved treatments. They've been through multiple clinical trials, have been approved by Health Canada, and to be safe and effective treatments for Alzheimer's disease. We're not saying not to utilize alternative therapies. Of course, it's a very personal decision, but definitely do your research, talk to your pharmacist, talk to your physician, and just make sure that what you will be taking is going to be safe. Natural remedies can change the way prescription drugs work, so always talk to your doctor or pharmacist and tell them which natural remedies or products that you are taking or looking to take, and ask about possible side effects and interactions with your current medication. So it's we're fortunate that we do have medications available to treat the symptoms, but we know that sometimes it's not always easy to encourage our loved ones to take this medication. So this slide just provides you with some strategies around encouraging medication. Some of these you may be familiar with, others may be new to you, but we talk about memory aids. So perhaps it's Post-it notes with notes reminding the individual what time they have to take their medication or that they need to take their medication. For some, crossing off days of their calendar, which helps just orientate them to the day of the week. is helpful. Others may use a timer. Timer goes off, it's time to take my medication. Support from others, so perhaps phone calls at the same time or when the time of the medication to be taken is needed. So, hi mom, it's 5 o'clock, it's supper time. Have you taken your medication? Okay, time for your medication. Perhaps setting it out the night before so that it's cued in the morning. You get up, you see your medication beside the coffee pot. Okay, I know I need to take my medication. Or if there's home care or other support services providers within the home, perhaps they can also help to remind the individual to take their medication. Blister packs or dosette boxes are great as well, a way to keep medication organized, great for the person with dementia to recognize, okay, I've taken my morning pills, now it's lunchtime, I got to take my lunchtime pills, it's Monday. So a great tool in terms of keeping medication organized. It can obviously be filled in by the pharmacist and delivered or picked up, so that's great as well. It can cause some less confusion, especially if the person is taking multiple medications. It can become very confusing as the disease progresses to keep that organized. So we invite you to choose 1 or 2 new strategies from the list that you may think might work for you, that you've tried. Maybe you've tried in the past, try it again, see how they work. And again, we know that what works one day may not always work the next. So important to have a lot of tools in your toolbox in terms of strategies. There is a link here to an article called 11 Ways to Get Someone with Dementia to Take Their Medication. So you can certainly visit that. Some of the strategies on that in that article are listed here on this slide, but there are some other suggestions as well. If you are struggling with this, please reach out to your social worker. They can also provide you with some other strategies that will help to hopefully make medication administration go a little bit more smoothly, again, if you are struggling with this. In terms of next steps, so next module will focus on adapting to brain changes. So we will look at changes in the brain, how to adapt to these changes, and ways to maximize brain health. Again, you can reach us at the Alzheimer's Society by calling 519-680-2404. You can visit us at www.alzheimerlondon.ca. Please reach out to your social worker if you have questions following this module. And I thank you very much for watching. Take care.